have how many suction machines, sister?
Why? Suction machine, we have shortage of it. Now, unless maybe it's in the store, we have one here.
We think we're the first in sub-Saharan Africa to design, build locally, test. It's gone through Kenya Bureau of Standards, it's been approved, and do clinical testing at Kenyatta National Hospital. Part of the project also was to build capacity, because when we first took this device to the Kenya Bureau of Standards, they didn't believe that it could be built locally.
We are usually happy today because we received a team from Makerspace.
We are here to improve on the maternal health, the neonatal health, and the child health. We are not working in isolation. There are things we learn from you. If you don't have a suction machine to clear the airway, the child will die, isn't it? We want the child to survive, we want the mother to survive, and the neonate to survive. So that's why we have been working with the students. We started working with them, some of them they were still young at the university. They are through universities and now they are employed. So we came here to see in the counties what is it that they are doing, isn't it? Because I'm sure your children are surviving, isn't it? And we also want them to see, not only in Nairobi, but also to come in the county and see what is it, these equipments that are in the county. So we are coming on the ground, capacity building, seeing all those simple things that will make the child survive or the mother survive.
What we found out when doing the hackathon is we can compress all that and do it in one day. At the end of the hackathon, at the end of 6-8 weeks, have not a functional prototype, but a prototype that showcases exactly what you want to do.
They realize that a suction machine is very critical in the management of patients. You have children who have blocked airways, they need to be managed. That sections must be removed for them to be able to breathe properly.
Our approach is this. But anything that is local, that is currently at this moment locally available, we use. Then anything that is not locally available, yes, we import for our purposes. But once the machine goes out into the market, then those parts then become locally available because the assembly is being done maybe in an industrial area. But the rest of the machine, everything else is things that you will go to Nairobi and buy. Some of the changes we've made is, for example, these the suction bottles are available locally. It can be used with a mother and it's easily used with a child.
At least modification, maybe show power is on,
yes.
Show also the failure, pump is on.
Currently, our equipment, which is not in good shape, is researched. So others, I think they are in good shape.
And the transportation of all these equipment from abroad to Kenya, and we have people who can make this thing locally. It's a classic.
I'm Kabale, maternity nurse. We have targeted the right area. That is maternity and the newborn unit.
Maternity ward.
Suction machine, there is a stair and the bed. Yeah, delivery bed.
If this one gets filled, one of them gets filled, you are still sucking, you go to the other one.
Yeah, and
as you continue resuscitating.
Thank you, I'm Mary. I'm a nurse manager. It's quite good. It has touched more on the maternity issue, that is the things that we use day-to-day activity. It is very, very beneficial for us because it will help to reduce the mortality rate, that is in the neonate and the maternal.
Okay, my name is Dr. Jaldesa. It's a good thing you've come and seeing what we do here. I have a cesarean section right now, and I probably need to wheel the patient to the theater, and you have seen the state of our stretcher. So for example, you know, all of us, we want better care for the patient and for efficiency, and we need proper working equipment.
It was interactive, whereby we talked about our challenges, how to counter it, how these machines work, the challenges with the machine. So we are happy and we welcome this type of collaboration. These equipment will improve in our service delivery. It will also increase our efficiency.
I appreciate the journey to Marsabit, and it's also good that we have learned what these people are going through. First of all, I wish to appreciate their patients coming to the hospital. That means they trust in the hospital. We have gotten feedback. Despite their challenges, they are still working. With the feedback that we have gotten on the ground, we are going to improve the survival of the child, survival of the neonates, and the survival of the mother.
It's also just having a product that we know is safe and it's been approved by all the institutions.